This episode is brought to you by CDW Healthcare. CDW understands how to connect the latest technology solutions and services to advance your healthcare mission while keeping patient and staff at the forefront. Whether you're looking to upgrade your EHR, redesign your infrastructure, improve care delivery at the bedside, or elevate the home health patient experience, our dedicated team of industry-tested experts leverage software, hardware, and comprehensive services to orchestrate cost-effective solutions that leads to positive patient experiences, higher quality care, and more efficient clinical workflows. For more information, check them out at thisweekhealth.com/CDW. Today on Keynote.
Whether it's cybersecurity or data and analytics, or even the EMR, you have to have a really superset kind of picture of what you intend to accomplish. If you don't have an understanding of how to orchestrate that from a technology perspective, you're almost doomed to failure.
My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump right into the episode. All right, it's Keynote, and today we're joined by Dwight Raum, CDIO, Chief Digital Information Officer at Rochester Regional Medical Center. Dwight, welcome to the show.
Thank you, Bill. Great to be here.
So how long have you been at Rochester?
I've been here since December of 23, so about 7 months right now.
7 months in. That's good. So that'll help to drive the questions. I love when people come into a new environment and how you acclimate and understand what's going on, and then how you become a part of what's already going on there. Before we get there, though, I want to give people a little bit of your background. Help us to understand your career journey. So how did you get to Rochester Regional, and how did you get into this field?
Yeah, so it's interesting. My undergraduate degree is in information systems and management science, very much operations oriented. And I came out of school at a time when the internet was really in its infancy, and I had this sort of natural gravitation towards it. Spent a lot of time in my early career in consulting and bounced around a bit, but then I found myself at Johns Hopkins Medicine in 2000. And I spent a lot of time at Hopkins, about 20 years in total. And when I arrived there in 2000, it was really as a technologist, working very much in the weeds of identity management and cybersecurity, early days then of cybersecurity. But I found myself in the role of CTO about 5 or 6 years into my tenure at Hopkins, and ended up my career at Hopkins as the interim CIO. I left in 2021, joined a joint venture called Quill Health. It was a joint venture of Comcast and Independence Blue Cross out of Philadelphia. And we had a really cool solution for aging in place using IoT devices in seniors' homes and machine learning to model behavior of those seniors in their homes. And then I found myself here at Rochester Regional a little bit later in 2023, consulting, trying to help steer this organization down a path of sustainability and strategic growth. Also trying to help this organization navigate coming out of COVID. As much as COVID was a massive challenge for us in terms of a care delivery, it also, I think, blew up a lot of the really good things that were in place from an IT management standpoint, like governance. So some of the basics we needed to revisit and really re-implement back here.
The pandemic was probably the best thing to happen to governance. And people will say that during that time, we were very effective as both IT and as a health system. And then we just went right back to, there's mergers and acquisitions, there's new initiatives, and getting all that stuff under control and just understanding the limited resources is challenging. So did you follow Stephanie Reel then?
I did, yeah. I worked very closely with Stephanie Reel for the majority of my career at Hopkins, and still work with her. She and I actually just spoke this morning.
Wow, that's fantastic. Stephanie is one of the people I heard from early on when I came into healthcare, because I came in from outside of healthcare and connected with her and learned from her up at Harvard. There was a class up at Harvard and she spoke up there and it was exceptional. The CTO to CIO, I will say that probably used to be a very common path, is not as common of a path anymore. What's the benefit of taking that technical to the CIO role?
Yeah, that's a really good question. I think for me, at least, having the depth and technical experience allowed me to see opportunities that others may not have. While I was at Hopkins, I had the opportunity to help launch an innovation center. And a lot of that was rooted in technology innovation, but bringing it to bear in the clinical setting or in the research setting. A lot of that I don't think would have been possible without having that depth of experience using technology hands-on early in my career.
One of the things I throw out the A word a lot on the show, and meaning architecture.
Hmm.
And it's interesting to me how many of the problems that we face in healthcare, security related and other things, could have been averted with good architecture. And when people say to me, why would I hire somebody who really understands technology? It's more of a leadership role now. And I say it's absolutely a leadership role, but you need strong technologists because architecture matters just like it does if you're building a skyscraper or something else. And we're building those kinds of complex systems in IT these days.
I completely agree. And you look at the complexity of the healthcare technology ecosystem, you can really paint yourself into some corners if you're not thoughtful about where you intend to go and the steps it's going to take to get there, whether it's cybersecurity or data and analytics or even the EMR. You have to have a really super set kind of picture of what you intend to accomplish. If you don't have an understanding of how to orchestrate that from a technology perspective, you're almost doomed to failure.
Yeah, so you come in 9 months ago with your background, your experience. How do you step into the conversation? And actually, I guess you came in before that. You came in as a consultant. How do you step into the organization to figure out what pace they're moving at and what things are important to them?
Yeah, I think there's a cookbook of things that you look at from an organizational readiness perspective. What's the velocity of change? How good are we at change management? How well connected are we to the operations? How good are we at governance? There are a lot of sort of basic things that I look for in terms of building blocks and start to evaluate the organization against those building blocks and understand what our discipline is in terms of enforcing those and following those best practices. From that assessment, I was able to determine there were certainly some opportunities, but going back to that architecture question, what was the vision for our organization? How are we as a technology delivery organization serving the mission of this organization long term? And that led us down this path of doing a strategic planning exercise, which was an incredibly powerful tool for me, at least, to discover a little bit more around where those gaps are, but then also thinking about what's our vision going to be as an IT organization. That really springboarded us, I think, forward into the conversation of how are we pivoting this organization long term? How are we achieving financial stability going forward?
But was that strategic planning at the IT level or was it across the entire organization?
It ended up being both. Initially, we spent a lot of the time focused on IT internally, trying to, like I said, get things right. And but then also thinking about what the future would be and supporting where the rest of the organization would be. And that flowed right into an overall enterprise strategic planning exercise.
Yeah, it's interesting as you have those discussions. What are some of the things that popped up that maybe there wasn't strategic alignment between IT and the organization? If you're able to talk about one or two of them.
Yeah, I think some of the challenges that we face here are probably not unique. Certainly, they're not unique to Rochester Regional. They're industry-wide challenges. I think understanding the real risk of cybersecurity and the need to make appropriate investments is an area that is not well understood by the layperson. I think it's more acute now as we've seen Change Healthcare and we've seen what happened with Ascension Health. It's become more real, but that's a gap that's hard for folks to truly understand. The other area that I would say is a challenge, and again, probably one that again goes back to that architecture question earlier that we talked about, is the importance of data and analytics and being very prescriptive and deliberate about how you intend to curate your data and use it long term to drive decision making. As we look at how we are transforming healthcare with a CMS rule coming around value-based care in 2030, I think the importance of data and managing your data estate as an asset is something that many organizations are now just starting to grapple with. So while we're making strategic changes to the organization in terms of how we provide care to our patients and how we take risk or how we don't take risk, we need to make sure that we're correlating that with a similar type of changes in the technology to support it. So that surfaced some gaps there, I think.
When you talk about data and analytics, it almost reminds me of the Covey principles, begin with the end in mind. Talk to me a little bit about how you communicate to the organization to help take these concepts like around cybersecurity and what that really means, or the effective use of data as an asset. How do you make those real to people in the room? Are there stories you tell? Is it just taking articles and saying, hey, here's change in Ascension? That
Yeah.
could be us.
I think it is a little bit on the latter, right? If you can use contemporary events or current events to help you make a point, you absolutely do that. But storytelling is the key. I find myself abusing and misusing many analogies, but a lot of times they're compelling and helping me to articulate what we actually mean from a technology or strategy perspective. One of the analogies that I've probably overleaned into is over the years, I've used this analogy that information technology is a lot like football. You actually have three different teams within a football team, right? You've got an offense, you've got a defense, and you've got special teams. Infrastructure and operations, cybersecurity is all about defense, right? Your success there is not having failure. Your application teams, where you're actually delivering the business using technology, that's your offense, right? And success there is moving the ball down the field, scoring points. And then you have special teams, and you'll find that special teams is usually comprised of the players from both offense and defense. And they're the game changers, right? They're the ones that are going to tackle really unique problems. They're going to try to pull trick plays, things like that. That's an analogy that I've found incredibly powerful to help articulate to the layperson and many of my colleagues just how we're organized, but also how we stand up and resource these teams in an appropriate way.
I love that analogy. So the special teams, does that manifest itself as project teams, or does it manifest itself as innovation groups, or how does it manifest itself?
Yeah, I think it manifests itself as both, right? In its purest form, special teams is really innovation. But innovation can be, thought of in a couple of ways. It could be cross-functional teams that are going after a very acute problem that you're trying to tackle with alacrity. But it could also mean targeting a problem that is much more ambitious in terms of, are we going to invent something new here? Are we going to employ new technologies in a new way? I think it covers both aspects of that. So it can be innovation that's externally focused, and it can be task-oriented innovation that's internally focused.
So I'm hearing a lot of people look at the problem to drive the innovation, but I'm also hearing a lot right now around, I don't want to say product-based innovation, but I want to say essentially around AI. So everybody's, man, AI can do all these things. And there's almost this need for us to get our arms around what can it really do effectively and what can it do safely and those kinds of things. Do you feel like you're being pulled in both of those directions?
I do. AI is so frothy in terms of the hype cycle right now. There's not a day literally that I don't get multiple emails from some random AI company that has a solution for me. But in that froth, there is reality. There is new capability that we can bring to bear. I think the challenge is to maintain enough wherewithal, and this is where I've tapped a lot of my technical experience. Understanding of how these tools actually work helps you also understand what their limitations are and where they may apply. Through all that froth, how do you see what are the opportunities that you can actually employ these things in a safe manner? I think your point about what can they do in a safe manner, what can they do in an assistive manner is spot on. In my view, it's, a lot of times these are being productized, as you said, or sold as complete solutions, but I see them as tools that are part of a portfolio of solutions that you bring to bear.
Hey everyone, Drex DeFord here, and we have an exciting webinar on October 22nd at 1 p.m. Eastern. It's sponsored by CrowdStrike and AWS. We're diving into building a resilient healthcare system, cloud security strategies for today. With cloud breaches up 75% over the last year, healthcare systems can't afford to rely on outdated defenses. So join us as industry experts share practical strategies to strengthen your cloud security posture and adopt zero trust and boost operational resilience. Don't miss it. Register now at thisweekhealth.com/cloud security. That's thisweekhealth.com/cloud-security.
The amazing thing to me is it's just showing up on my desktop. Like they're not asking, they're not saying whatever. It's just starting to show up and, oh, there's now a box. Just ask your question and we'll create the workflow and that kind of stuff. Are you finding that's happening in healthcare as well? That's just popping up in some places?
There's definitely organic adoption of artificial intelligence tools. Obviously, LLMs are the big one right now that everybody's looking at. And I think there's real risk in that, quite honestly. There are reasons why we do risk assessments against these types of tools. A lot of what our responsibility is, I think, as technology leaders, is to educate our community on how these tools work, but then also what are the rules of the road for adoption of these tools.
So you're 9 months in, you have a strategic planning process. What projects does it lead to? What initiatives does it lead to? Does it lead to some blocking and tackling, but also some innovation as well?
Yeah, so a lot of my effort right now is blocking and tackling, right? Trying to get the basics and the fundamentals of the game executed and playing right. But we can't do that in isolation. We've got to spend some time also thinking about where can we really innovate. And I'm fortunate to work for Chip Davis, who's our CEO, who's somebody who's driven innovation throughout his entire career. And we have a very meaningful relationship and alliance with Rochester Institute of Technology, where we can tap into their faculty and their students to collaborate with us on innovative projects. We've had several examples over the years where we've done really pretty amazing things with T. As I've come on, as you said, 8-9 months into this tenure here, I'm looking for those opportunities. How can we build not a series of one-offs, but a programmatic approach to innovation in conjunction with RIT?
What's the foundation from, I guess you could take data or however you want to approach this, but what's the foundation for innovation? Is it the technology? Is it the culture? What aspects do you have to build up for that, for innovation to truly happen?
I think in everything, it's a mix of both, but I would actually say culture and people are the most important part of innovation. The technology pieces tend to be, you can use and mix and match a lot of the tools already, but you don't have to invent a whole lot to make something that's really new and innovative. So the key thing, I believe, is empowering people with the confidence to try things and to do so in a way that is safe, but challenges the way they approach problems. I think a large part of activating a large organization through innovation is giving them the permission to do these types of things and challenging them to do so as well. And you do that a lot of different ways, but one of the ways I've found to be very successful is you find case studies within the organization and you celebrate those. And those become guiding lights for others to say, hey, I can do that too. And a lot of innovation is throwing stuff at the wall and seeing what sticks. And a lot of it is about failure. So being prepared to accept and understand that failure is actually just a step towards success. It's not an endpoint.
I'm asking this more for the listeners. From time to time, I have sitting CIOs and others say to me, I want a seat at the table. But when I find someone like you and others, I say, have you ever had to ask for a seat at the table? And invariably, people look at me and go, no, I never had to ask for a seat at the table. They wanted me at the table. What differentiates? How do you get a seat at the table? What aspects make somebody say, yeah, we need Dwight at this table?
In my experience, the ability to have vision that's greater than just your immediate portfolio is critical. So if you can articulate a vision that touches a lot of different pieces and demonstrates understanding of how those other pieces work, but then also match it up with your portfolio, your technology portfolio probably, and orchestrate a path forward, that's incredibly powerful. Folks really want to have partners at the table that can help them not only articulate the vision, but also execute on it.
So deep understanding of healthcare, deep understanding of your system and its objectives, and then a deep understanding of technology and bringing all that to bear on solutions for the organization. Let me ask you another question. As you look back over your tenure, you've worked at academic medical centers, and I've spent some time in academic medical centers. Most of my time was at a large integrated delivery network. And I thought that a large integrated delivery network was very political, and it was very political, and there was a lot of different objectives and things going on. And then I spent some time in an academic medical center, and I realized I was in the JV. There's a lot of different initiatives going on in an academic medical center. There's research, there's money that comes from different sources and that kind of stuff. How do you guide things that are happening, but knowing full well that you can't control all the things that are happening?
That's a tough question to answer.
Without getting in trouble?
Without getting in trouble, yeah.
It really has been fascinating to me because we do 229 groups and we do at the academic medical center CIOs, and their approach is different. It is in some cases, they're almost a mentor to certain parts of the organization. In others, they actually have some control, but it's the discernment of knowing when you have what and being able to lean into those things.
Yeah, and I think there's obviously a political awareness that one has to have. In all jest aside, the way I approached it was there were core things that I had to deliver on, and I considered those kind of my sandbox, whether it was infrastructure and operations or applications and governance. I had a lot of control within those lanes. I had a lot of political and relationship management I had to do along the way to keep those lanes pointed in the right direction, so to speak. Then there were the activities that were extracurricular, where I could leverage my reputation, my gravitas, whatever, to help forward another initiative. Precision medicine was something like that for me at Hopkins, where my experience with what we were doing in technology could help inform how we would approach research. And then there are these just sort of crazy things, the chaos of all the different research initiatives that may be going on, or some new center that needs to be launched. And I put those in another bucket. So across all three of those categories, you had to have management strategies and leadership strategies for each of those. It also helped to have a team that was really long tenured and had enough wherewithal and understanding around what was going on in each one of those to help manage them as well.
We're going to end the conversation talking about emerging trends, but before we get there, I want to talk to you about organizational change management. And it's one of those areas that CIOs need to be so adept at. So you come into this organization, you've identified some areas to move. How do you do that? How do you do that effectively on the clinical side? How do you do that on the administrative side? You can't cover the topic in complete, but one or two things that you look at from an org change management.
So two things jump out at me. The first is you got to have a plan. So when I shared earlier that we put together a strategic plan, it was so that I would have a narrative to work from, something to start with. And then I think the second thing is relationships. That's a really big thing, right? So relationships within your IT team, you've got to really ensure that you're, going back to my football analogy, that your unit is tight, that you guys know you have each other's backs and you know how to operate together. So the internal core team has to function really well. You have to be able to trust your team. But then it's also about building relationships with your operational leadership. And that means getting out there and beating the bricks, so to speak, going and meeting folks where they are, both literally and figuratively, understanding what their challenges are, bridging that into your strategy, sharing a little bit of your vision, and being really open to feedback.
You're a man after my own heart because I came up through the CTO ranks as well. And so I want to spend some time here at the end just talking about trends and technologies that you're keeping an eye on that you think could have a serious impact on some aspect of what's going on in healthcare.
I don't want to spend a whole lot of time on AI because I'm sure you've probably talked AI to death at this point in your conversations. There is real value there. And I think the things that I'm keeping an eye on there are specifically portfolio of AI solutions. I see so many like laser beam solutions. Take the LLMs out of the picture for a moment. So many laser beam solutions, they really need to be brought together into full suites, right? And in the future, I see healthcare and personalized medicine really getting a lift from those AI types of tools where perhaps we have an equivalent of a digital twin running for each patient. That's not inconceivable in the not too distant future. Parking the AI discussion aside, I'm actually super excited about the prospect of like drones, to be honest with you. When we think about what we've done over the last 30 years in healthcare, in digitization of healthcare and moving things into really managed systems into the EMR, what we've effectively done is just built a really good collection system for signal. So we've got all these data points coming in now, and we are now starting to make models and understanding that signal. A lot of that was dependent on the docs and really falling to them to handle the additional burden of all that data. The AI models now are helping us to understand that more rapidly. But what we're missing still is a little bit of that effector arm, right? So how do we actually take that signal, assimilate it, turn it into a model, and then do something with it? Now, I think all of us as technologists tend to fall back to, we'll send another email or we'll text message or we'll target an ad or whatever. But I actually think we're getting into the realm of we can actually do things with robots. Drones are an example of a robot, but we have a robot running around our hospitals doing deliveries from med cabinets to the units. I think there's a tremendous amount of opportunity for actually doing real things. So moving beyond just signal collection into actually using robot technologies to do physical things in the real world.
I'll make it easy for you. When you paint the picture 10 years out, there's probably extensive use of robots in healthcare at that point.
I think so, yeah. And the robots they're just the actuator arm of all this intelligence that we're drawing from the data that we're collecting and the models that we're running. But the more of those that we have, and let's talk about aging in place for a moment, going back to my prior experience with Quell Health, you need that effector arm in the patient's home. And that could be a lot of different things. It could be a pill reminder with a machine that's actually doing distribution of the pills. It could be a refrigerator door closer, things like that.
We're going to have pill dispensers in a remote patient's home that only dispenses the pills that they need at the proper time.
It's possible now, yeah.
Yeah. It's an interesting future. I think of all the challenges that we have to deal with. I was talking to somebody about the Chevron ruling this morning, And I think it doesn't seem like a big deal, but it is a big deal because it changes so many things. And you're like, yeah, there's all these things we really want to accomplish, but we have to keep an eye on all this blocking and tackling just to keep things going. Dwight, I'm looking forward to staying in touch. I appreciate you coming on the show and sharing your experience. It's fun to catch up with you again.
Great to chat with you, Bill. Thanks for having me.
Thanks for listening to this week's Keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. Love it if you could do that. Thanks for listening. That's all for now.